Hey everyone, thank you so much for commenting on my last video. So here it is. I'm just going to lay this out. These are it's pretty much just information that I gained along the way of going through IVF and things that I wish I would have known, things I wish someone would have told me. So I'm just going to share these with you. I'm not suggesting any of these things to you. I'm just sharing what I know. Feel free to take my advice if you want to. My first thing, and I'm sorry, I'm warning you, you can hear Blitzen crying in the background again. So be prepared for hurdles, and with that I mean that your doctor can cancel your IVF cycle at any time for any reason that they see fit. And that made me super nervous because my hurdle happened to be that I had a cyst that developed somewhere between the time I started the Lupron shots and then I had it's like a baseline E2 blood draw and a baseline ultrasound. And that's when they found the cyst. And it happened a couple days before my stimulation medications. If that would have happened afterwards, my cycle would have been canceled because the stimming meds would have just made the cyst 100 times worse. Just go in knowing that for whatever reason, your doctor would cancel your cycle. It's for your health reasons, like your safety reasons. I know it totally sucks. I was terrified when I knew I had a cyst because then I started Googling everything and people were saying that their cycles got canceled because of it. So just kind of have that in mind that there might be hurdles, whether that means they need you to come in for more blood work, they need you to come in for another ultrasound. There's always going to be something unexpected. So just kind of go in knowing that it's not going to be as smooth as you hope it to be. And if it is, that's amazing and very unlikely, but just kind of roll with the punches. My next piece of advice is if you can tell your whoever you want that you're doing IVF. For me, I kept it pretty private. I told only the people that I really trust, only the people that I really needed their support from, that I hang out with very often, that I would want them to know if, I'm upset about something or I'm moody because of the medication, just that they knew what was going on with me. I also suggest that if you are comfortable, tell your boss, your supervisor, whoever, because you are going to be calling out of work a lot. I would say I probably called out 10 days, and that is just unbelievable for me to take that many vacation days and sick days this close in the year. I just got my days renewed in January, and I'm already down past half of them, and it sucks. Look into FMLA if you can. If not, look into short-term disability if you can, and just it just took the pressure off me to tell my boss where I was going, what was going on, and he was super supportive, and I'm just very lucky to have him as my boss. So next is Gatorade and water should become your best friends, and I'm talking like now. Like if you're starting your IVF cycle, start drinking water like it's going out of business. It really, really does help with the egg retrieval side effects. I had insane amount of bloat. I've never in my life experienced anything like that. I drank a ton of Gatorade and I drink water every day. It's really the only thing I drink. And after the surgery, I looked like I was 3 months pregnant. I couldn't button my pants. Everything was uncomfortable. Laying down was uncomfortable. Sitting was uncomfortable. Walking was uncomfortable. Eating, I couldn't even fathom wanting any kind of food because I felt so bloated. It was like one of the worst feelings I think I've ever felt. The Gatorade is really supposed to help with that. I don't really know if I believe that because I drank a ton of it, and I really don't like Gatorade, so for me to drink as much as I did, you would think it would help a little bit. The only thing that helped was time. I'd say about 3 or 4 days, maybe even 5 days after the egg retrieval, I finally started to see my abdomen deflating. Okay, this one is TMI. If you are grossed out by TMI stuff, I suggest you click off this video. It's very embarrassing for me to talk about, but I wish somebody would have told me about this, so I'm going to share it with you. Please don't judge me. Bodies are a really weird thing. You can't control what happens to them. So, when you are going through IVF, you are taking injections that suppress your body from doing what it's supposed to do naturally, which is ovulating. And even though the body, like the medication is suppressing it, your body still thinks it's going through that. So whatever happens during ovulation for you in normal life is intensified 100 times more when you're going through it on IVF. What I'm talking about is EWCM. If that happens for you normally, expect like a crazy, weird, unbelievable amount of EWCM. So much that it scared the hell out of me. I called the doctor, freaking out. I didn't even know that much, that my body could produce that much. It was terrifying. So with that, my piece of advice is to buy panty liners, because it comes when you least expect it. I mean, it was just out of nowhere. And also, if they start you on the pill at the beginning of the cycle, you're going to want panty liners anyway, because you might spot, you might have a full-on period because of it. So buy panty liners, you will need. Okay, I'm moving on. A heat pad after egg retrieval is your best friend. I didn't really have any symptoms after the egg retrieval besides the bloat, but like pain-wise, I don't want to say I was in like terrible amount of pain, but like 30 to 40 minutes after the egg retrieval is when it kind of starts to set in, and it's like very, very achy, kind of like you're on your period times 100. It's just really uncomfortable. And the only thing that really helped me was the heat pad. I put it across my abdomen and I fell asleep within minutes, and I slept it off. When I woke up, I felt fine. I felt tender, like if I would laugh or push to go pee, you could feel like your ovaries, like it hurt, but it wasn't like I didn't have to take any pain medication because of it. So get a heat pad if you don't have one. Embryo transfer. The only advice I really have about this, really for me, is just expect your numbers to go down a ton. I had 12 eggs retrieved, which I thought was a great amount, and the doctor did too. He said he had a lot to work with, and when you hear something like that, I honestly thought like, wow, we're gonna have so many left over. I mean, I had 12, so I'll probably, implant 2, and then, I'll have like 6 or 4 or 5 to put in the freezer. And it turns out, my 12 went to 8 very quickly. 8 went to 6. 6 went to 5. I think 4 fertilized. And they all looked good. So we put 2 in. And then 1 kind of just stopped developing. So only 1 made it to the freezer out of all that. So I was really upset about that. But after talking to the doctor, it's just nature, and that's just what happens. Not every embryo is meant to become a baby, so when they die off like that, consider it a blessing. They're just not meant to become a baby, and you just have to expect or accept that, and hope for the best. So the other thing I wanted to share with you guys is I have no clue if this is normal. My doctor says that it happens sometimes during the transfer, but when he put the 2 embryos in, you can actually see them, and this is where this comes in. You can actually see them on the ultrasound. So this is your uterus, and this is the catheter. There's like the little white dots. Well, there's only 1, but you can see it move through the catheter into your uterus, and that is actually the embryo. It's surrounded in fluid, which is what you're actually seeing. You're not seeing the tiny little embryo that's like microscopic, but when you do that, you can see it then, and you get, well, if your doctor is nice, they give you a picture of it. But once that was done, the speculum came out, the catheter came out, and he's like, we just have to hang here for a minute because I need the embryologist to make sure that both embryos made it into your uterus. Some like to hang out in the catheter, some like to hang out back in like the dish or whatever it was in. And I thought he was kidding, but no, that happens, and it happened to me. Only 1 embryo made it in, and they actually had to do everything all over again. So the speculum goes back in, the catheter goes back in, and then they do the whole procedure over again. And you can actually see in your uterus where the 1 is and like where the other one's going. But it is so uncomfortable. You have to pee so bad. All of this is done on a full bladder, and while that's going on, there's a nurse pressing on your abdomen, like your bladder, with the ultrasound wand. So it sucks, and to have to do it twice sucked. So hopefully that doesn't happen to you, but if it does, it happened to me too, so whatever. What else do I have to say? The 2-week wait is the most horrible 2-week wait you could ever imagine. It literally drives you up a wall. You question everything. You are anxiety ridden. You think every little symptom is a sign of pregnancy, or if you're taking progesterone, which you probably will be, the progesterone also sucks. I had Crenone, which is a vaginal insert, and it caused incredible back pain, headaches, nauseousness. It was just nauseousness. I don't even think that's a word. Nausea. It was just awful. So during that 2-week wait, my advice is to stay off of Google as much as you can. It doesn't help the cause. And I would just say, do things that make you like really happy, like genuinely happy, whether it's going out to eat, just hanging with your friends, going to the movies, staying home and watching movies, reading a good book. Just try to do things that take your mind off of it. This next time around, I know that I'm definitely staying off of Google. That was the worst thing I could have done. And I'm putting it in God's hands. I mean, I did that from the get-go, but really this time it's about me just kind of trying to be zen and know that no matter what the outcome is, God is doing this for a reason, and it's not up to me. It's not up to my doctor. We can only do so much to try to help this process, and just give it to God. So my advice is to do the injections yourself if you can. Even if you just do one yourself, just do it and get it over with. I promise you'll be really proud of yourself. I ended up doing my injection, my first injection with the nurse, just with sodium chloride, just to make sure that I could do it, because I was so afraid that I was going to wake up that, like, I don't know, Wednesday morning, whenever it was, and try to give myself the Lupron shot and freak out. So I did it with her there, and I was on a high for like 2 days because I was just so proud of myself that I could actually do something like that. It was something I never thought I could. And because of that, I was okay with doing the Lupron shots by myself. However, when it came to like my 3rd or 4th one, I was like on the 4th day of it, I went in crooked with the needle, and that is what hurts. If you go in straight on, you cannot feel it. The needles are so small. But I went in crooked and it scared me. I jumped and I pulled the needle out crooked and it made me bleed, and it kind of just scarred me. I just didn't ever want to do my injections again myself, and that turned out to be a blessing in disguise because Chris took on the role of doing every single injection for me, and it got him involved in a way that he wasn't involved before, and it really, I keep saying and, I hate that, but he's like, the guy doesn't have to do anything. The guy really only has to, you know, provide his specimen on the day of your egg retrieval, and that's it. There's nothing to it for the guy. For the girl, it's, you know, injections and surgery and medication and the 2-week wait that you drive yourself crazy over. So getting them involved is awesome. So if that's a possibility for you, let them do it. The next thing I just wanted to say is before your trigger shot, mine was at 2 a.m. So, and I had to work the next day. For me, I just wanted to wake up, do the shot, and go back to bed. And I woke up at like 1:45. I got the shot ready. We got the injection site ready. Chris gave me the shot, and I went back to bed. And I really wish I would have done, you know, I would have woke up at like 1:30 and gave myself at least 15 minutes to ice the area. The needle is effing huge. It is the scariest needle. However, it really doesn't hurt. It doesn't. I mean, there's metal piercing flesh, so yes, you can feel a pinch, but the needle itself does not hurt. What hurts is afterwards for like days. My butt was so sore for like 3 days. So my advice is wake up a little bit before, ice the injection spot. After the injection is over, ice your butt for a good 15 minutes before you go back to bed. I think that's it. This video is getting so long, and I apologize for that. If I can think of anything else, I'll make another video. I hope this was helpful. Again, it's just my information I gain along the way, so take it as it is, and I will talk to you guys again soon. Bye!